Instagram as well.
Hi everyone, it's Amy again. I'm here to demo a VI peel on Jenny. I'm going to go ahead and start by degreasing her skin. We're going to use a pure acetone on her skin just to help make sure we get it nice and dry. If there's any oils on those skin, sometimes it'll create kind of like a vehicle to drive the peel down a little bit further than what we want. So we are going to dry her out completely. To me, this is the worst part. It's kind of stinky, but once you get past that, very easy peel. So we'll degrease her.
Why do you need to degrease her?
So we degrease to get all those oils off the skin. Once the oils are off the skin, it's nice and dry, and that peel will not penetrate any deeper than I want, because we want a slow penetration, so we want it to be nice and dry. So the first thing I'm going to do is go ahead and dip into my peel here. We're going to apply one layer on her skin. There are some phenols in this peel which actually help to numb the skin. So what I'm going to do first is just do a nice light layer, let this sit on, and then we'll apply multiple layers after.
Now you said it's numbing, so is this something that's painful?
No, not painful at all, but the numbings just help to really do just that, numb the skin so you don't feel a thing. It's a very easy, non-painful peel. I've been doing it for a while and I've never really had anyone complain about burning, itching, anything. It's really just kind of the smell of that acetone that gets people.
Is there a peel that does face and chest?
This can do chest, which is really nice. So you can bring this peel down to the chest and we can do the same thing on the chest. Really, really good for hyperpigmentation, really great for melasma. It's great to do yearly just to kind of brighten that skin up after the summer. Very good anti-aging. So all around, any concern you could really have, this peel will address it.
And now can any skin tone or skin type get this peel?
Yes. So any skin tone from my lightest to my darkest can handle this peel. When you get more sensitive skin types, usually I like to see you first, get my hands on you before I feel comfortable doing this peel. But yes.
So those people who were tuning in for any of the IPL live demos, we got so many questions about, can I do this with melasma? Can I do this if I have darker skin? And
right.
Our answers were unfortunately no.
Right.
This is a great option if you have melasma or pigment and you have a darker skin tone.
Exactly. So typically what I'll recommend to a lot of my people that go to laser first and get told basically you're not a good candidate, they come to me and they have melasma, they have darker pigmentation that's just not able to be reached with the IPL. This is the first thing I'll recommend. It's a great job. If you have the time for the downtime, which is anywhere around the week, it's more or less social downtime. You can continue your life, but do you want to go out in public peeling? This is my go-to. I love this peel. Does great for melasma. Typically, you'll want to get around 4 treatments. I'll say, think in the ballpark of 4 treatments. You may not need that many, but that's what I would recommend starting out. And we'll kind of just see, we'll touch base after each peel, see where you're at, and go from there.
And then are you going directly under the eye with this peel? Or?
Yeah. The fun part about this peel is I follow just that orbital bone. On the very last pass, when I don't have a lot of solution on my pad, I can pull her skin down really taut and kind of get up underneath that eye a little bit, which is really great. Because most times we're not going to really get underneath that under eye. But on my very last pass, I can pull her skin down and get up underneath that eye a little tighter.
If you have rosacea, can you do this peel?
You can, as long as you're not having a flare-up.
Okay. And then someone said, I missed those IPL demos. Did I understand that you cannot have IPL if you have melasma? That is correct.
That's correct, yeah. We would definitely recommend against that, just because the bounce back of your melasma from that IPL can just create worse melasma than you had. That heat really helps to pull that pigment out. So we don't treat with IPL.
Now people are saying, what are all the peels I've been seeing? Now I'm confused by all the peels, but I think we originally did a VI peel this morning, which is the same peel that we're doing now.
Right.
And then I think they're also thinking about, when you talked about the hydrofacial, you mentioned there's a peel in that.
Right.
So what's the difference?
So very big difference. Your hydrofacial peel is just going to be a glycolic salicylic mix. Only goes up to about a 30%, very light, not really enough to even get you tight or flaky. This one, our main focus is to peel you. We're really kind of digging in deep. This is a medium depth peel. This is a very intense peel. So very different. We're not gonna bring this in with another facial we do. This is a standalone treatment because it's pretty intense.
Someone said, I have some white spots on my skin. Would this be good for that or something else?
I would have to kind of see what you mean by white spots. It could be a couple different things. If it's hypopigmentation, which the skin just lacks pigment of itself, no, it's not really going to create that skin to then, make pigment. If it's a whitehead or milieu or something like that, it can help. Probably if you came into my treatment room and you had milieu or something like that, I'd probably just extract it before we started. But it just depends. I would have to see what white spots you mean to give you a good answer.
It says, I have a spot of melasma just below the outer quarter of my eyebrow. Mm-hmm. Can this peel get that, or no, is it a no-no because of how close it is to the eye?
I would, outer corner of the eyebrow, I think I'd be able to treat it. Again, I would want to see you before I gave you a definite answer. Mm-hmm. Yeah, I would just want to see before I told you for sure yes or no.
And then Gina messaged in and said, I just got 2 IPL facials today, but my main concern is melasma. Gina, if you email support@nyac.net, we will be able to help you there the best. So that was support@nyac.net. Let's see. You say medium depth. What peel would be stronger than this?
This is probably our strongest. We have a mini melanage. I still think this is a little bit more stronger than the melanage. The melanage peel is really good for my darker skin types that are suffering with pigment, but the peel itself isn't as strong in my opinion. The 2 cream that you get sent home is what kind of makes that peel. And I would say this is kind of the strongest. No, you're fine.
What is the aftercare?
Aftercare, it's fun. You get a couple things to go home with. So you are going to get a full-size thing of SPF 50. You're going to get hydrocortisone cream to go home with, because once you start to peel, it gets a little uncomfortable, especially that first day or 2 when you start to peel. You'll be a little itchy, your skin will hold a little bit of heat, a little bit of redness, but we will give you a 1% hydrocortisone cream to go home to kind of help with that. You will also get peel pads. So when you come in for your consultation or when you come in for your peel, I will go over, before I even start your peel, what your home care will be. Because you're going to have a couple things to do that day that we place the peel, and if you do the plus, the next day you'll have a couple peel pads. So I will write it out. I will let you know exactly what you need to do. I will tell you what times you need to do it. It's kind of foolproof, and it's worked for me. And I'll give you my contact information. So if you get home and you think, I have no idea what we talked about, I'm always there too to help you kind of go through the whole process.
Mm-hmm. Let's see. Can you wear makeup right after, or should you wait?
Right after, you're going to look kind of like this. The peel has a little tinge to it. You might look a little orange when you leave. So I would suggest right after me applying, I wouldn't. But in 4 hours, she's going to cleanse her skin and do a post-peel towelette. Once she does that, I'd be okay with you wearing makeup all the way up until the day you peel. So once you start peeling, that's when I will say there's really no point to wear makeup. You're going to look kind of goofy anyway. So no makeup until you're done peeling at that point. But up until you peel, feel free.
Can you compare the laser to the peel for sunspots? That was IPL versus this.
Basically, in my opinion, if you're a good candidate for laser, I'm going to send you the laser. I love the way the IPL works. I think it works really quick. It does a really good job. It's collagen inducing. I love the laser for pigment. But if you're not a good candidate for pigment per se, I would say then come back to the VI. And if you want to do both, it's a great thing to use in conjunction, your IPL and your VI. So we can do your VI, and then a few weeks later you can go back and get your IPL. So we can do them together. But if you're not a good candidate, this 100% I would say is the way to go. But if you are, I would say do IPL.
How many days do you peel?
I say prepare yourself for 7 days. You may not get a full 7 days, but I'll kind of prepare you for the worst. So you're going to apply this peel. You probably won't start peeling for 48 hours, 72 hours. So you have a couple days after I place this before you start peeling. And then once you start peeling, you're probably going to have a good 5 to 7 days of peeling. The first 2 to 3 being the heaviest, and then it'll start to slow down and kind of just flake out towards the perimeter of your face, and it's a little easier then. But the first couple days are the worst.
And then, do you know the contents of the peel?
Really, any acid you can think of. There's TCA, there's phenols, just every type of acid really is in this peel.
Okay, and then they said, which is more effective, this peel or microneedling?
That's a rough one. That's a good question. Again, your concerns. It depends on your concerns. If you're looking for more acne scarring, deeper scarring that's a little bit deeper, rolling scars, I would say microneedling, just because you're going to get down to that dermis and you're going to create those little micro injuries that are going to create collagen stimulation. This is great topically. It'll help to bring down that skin and work well too. So it just kind of depends, again, where your skin's at, where your scarring's at, where your pigment's at. But just like the IPL, microneedling and the VI go great together.
Someone said, what's this peel called? It's the VI peel.
The VI peel.
And it is a special today, the VI Peel Plus, right?
Yes. So they have a couple different ones. This is the Precision Plus. We also have a Purify, which is more geared towards acne. So if you have active breakouts, we would do more of a Purify, but the Purify Plus is what we're doing.
Let's see. Can you resume normal skincare post-peel? Tons of hydrating lotion for peeling, question mark?
Yeah, so I would say you can start your normal routine within a week after the peel. After you're done peeling, your skin's just now fresh and new. I would wait to start anything active. So your peel pads, your Koji pads, your glow pads, I would say about 2 weeks after you're done peeling, just to give your skin a nice break. And then you can go back with those acids and start your normal routine.
Someone said, I'm afraid to do this because I don't think I could stop myself from picking off the skin before I'm supposed to. Is that a thing?
That is true. So what I tell a lot of my patients, because you will sheet off, and it gets kind of annoying. So what I say is get a clean pair of scissors, alcohol them off, and cut as close as you can to that skin just to give you a little bit of relief. You definitely do not want to pull that skin off. If you pull that skin off, you then are open to hyperpigmentation, you're open to scarring. So if you don't think you could trust yourself, maybe it's not the best, but there's ways around it. I think once you start to peel, you'll realize, I'm not going to touch it. There's so many bad things that could happen from it, and I really don't have any. I have pickers that do it, and they do just fine.
Okay. Is there a lot of frosting with this peel?
Person by person. Some people I can do 1 or 2 passes and they frost and we're done. Some people I'll do and they won't frost at all. So it just depends again. Jenny has some pinpoint frosting throughout, which is great. If I see that frosting, I know you're probably going to peel probably on the 2nd day. If you don't frost, maybe the 3rd to 4th day, but she's got a little bit of pinpoint. She never fully frosts. This isn't her first VI peel, but yeah, frosting does occur.
Someone said, Amy, you're awesome, heart.
Love you. Thank you.
Let's see. What do you use on the skin while it's peeling?
So, in my opinion, I kind of say the less, the better. I kind of let you live in that dryness if you can handle it, because your peeling's going to go by much quicker. Now, if you feel like you just can't handle it and you want to throw some hydrocortisone cream on, that's fine. We'll give you that to go home, and you can use that up to 4 times a day. But I prefer you not to use anything on your skin but the products that I send you home with. And again, when you come in and get your peel, we'll talk all about it. That way you know exactly what to do, what not to do.
Can you exercise during the week of healing as long as it's comfortable, or is it better to avoid sweating?
I say to avoid it those first few days that you start to peel, because the sweat that drips down will sting. It will not be comfortable. I would say after those first few days are done and your peeling is not as intense, you can go ahead and resume your workout. But just know that it might be a little uncomfortable.
Is this good for post-inflammatory pigmentation?
Very good for any type of pigment. This peel is great for. Scarring, wrinkles, pigmentation, great for it all.
Someone said, already purchased Botox and filler, but I think I need to pull my credit card back out.
Do it. Do it.
Like Amy said, this is not Jenny's first peel. Jenny loves this peel.
Yeah, Jenny, I've done this peel on Jenny a few times.
What's your experience been with it, Jenny?
It's been great. I love it, obviously.
Yeah, she
You
does.
keep going back for more?
Really
Yeah, I always peel.
What do you notice when all the peeling's away? All done. What do you notice about your skin?
It's very, it's like glass.
Yeah, it's very bright. very, very bright. And the fun thing about this peel is they now have an app to go along with it. So when you download that app on your phone, you can take daily pictures, because sometimes you'll be done with your whole peel. If you don't have pictures to document it, you may not know what your skin looked like before. And those before and afters, I'm telling you, make a world of difference. So I suggest doing that when you do your peel.
Okay, and then can you get this if you have active acne?
Yeah, you can.
Okay. Let's see. Katie wants to know, how often does Jenny get it done?
I would say in the winter months, like she doesn't necessarily need a series or a treatment, because we're not really working on too much. This is just going to be a nice overall glow to her skin, a kind of a pick me up. So if you don't necessarily have one specific thing you want to work on with this peel, it's just a great pick me up, a great thing to do in the winter to get rid of that old summer dull skin and just give you a nice, bright, vibrant look. So winterly, quarterly, once, twice a year is great. Again, when you start to work on pigment, we'll do a series.
Okay. So it's kind of all over a good peel for everyone.
Definitely.
What is frosting?
Frosting is basically when that acid gets to the point where I want it. If it frosts, I don't want to really go over that. So if she has a whole blanch on her forehead, say a big white spot here, that's just an area I know that peel has gotten to where it wants to go, and I don't want it to go any further. So I will just avoid that area. But if she has little pinpoints throughout, love it, I'll still go over it. I just kind of keep an eye on those areas.
What is the pain level for this?
I mean, virtually none.
No pain.
There's really no pain. No pain at all. Until you start peeling, that's when you get a little bit uncomfortable.
I mean, you just get like kind of sensitive.
Sensitive,
You know,
exactly.
sensitive.
Kind of like a sunburn.
Yeah.
I mean, that's kind of what we're doing, kind of burning the skin.
Yeah, when that fresh under the skin underneath comes off, when you're peeling, that's whenever you can get a little sensitive.
Right.
So this might make you think back. What is the shortest amount of time you've seen someone peel and the longest amount of time you've seen someone peel?
2 days. Like, I applied this peel, they'll go home, they'll do towelettes tonight, and then tomorrow night when they're going to do their towelettes, they'll have some flaking. Now, you're not going to have that full-blown peeling, but you'll start to peel. And the places that you'll start to peel first kind of be those nasolabial folds around your mouth, just because that's where all the movement's coming from. That skin is just very moved around, and it'll loosen up quicker. So the longest, I've had someone go 4 days, like they've reached out and said, hey, I'm not peeling yet. And ultimately they ended up peeling.
So someone said, okay, so up to 10 days of peeling. So I would want to be off work, excuse me, I would want to be off work for like a week and a half after to not look like a leper?
It won't be 10 days of peeling. You'll be 7 days roughly from start to finish. Most of the time I'll have people come in and we'll do the peel on like a Wednesday. So by the weekend they're starting to peel, and then by Monday they're usually ready to go to work. But the best thing now is you're going to cover it all up with a mask. So it's a lot easier now, but I would recommend if you're working like a Monday through Friday job, come in, we'll place that peel that Wednesday, and then usually by the weekend you'll peel, get the most of your peeling done, and then Monday you're usually good to go back to work.
And then is this a good peel for men as well?
Definitely.
And how quickly will you notice results after the peel? Would you say when you stop peeling?
I mean, when you stop peeling, yeah, you should notice a good result.
Okay. Let's see. Does it burn? No.
You might feel a tiny bit of tingling initially, but nothing that's too uncomfortable.
Yeah. Only the first pass.
Yeah, the
is
first
like
pass.
Tingly a little.
I wouldn't even use the word burning.
No, just tingle.
Let's see. So many. Let's see. Someone goes, the mask coming in clutch on this one.
Right.
It's the perfect time for a peel.
It's the perfect time for a peel.
Let's see. Thank you for the information. Oh, how many days prior to the peel should you stop using glow or koji pads?
If it's my first time seeing you, I'll say a few days before. Usually you're using those weekly, or your glow patch weekly. You can use your kojis up until the day. Like I said, until I get to know your skin, I may have you do something a little different. Maybe the second time around we peel, but give yourself a few days off before you come in.
And then when can you start using those again?
About 2 weeks after you're done.
2 weeks,
Yeah.
okay.
Yeah, at that 2-week mark.
Someone said, what's the difference between this process and microneedling?
So this we're actually going to peel you. You're microneedling, you are creating all those tiny injuries into that skin internally, and then they're going to kind of work to build up the collagen from within. With peels, we're taking down the skin. So when we take down that skin, your skin then realizes, hey, I'm missing a layer. So it's going to kind of ramp up and then shoot out some new healthy skin cells. So it kind of just turns over that way. Whereas microneedling, you kind of create those little injuries, and then it starts to heal itself from within.
This is the VI peel for anyone just tuning in. We talked about kind of all this. Is this recommended for people with super dry skin?
I mean, I probably want you to get a little bit more hydrated before we start. It just depends, again, where you're at. I wouldn't, if you are sensitive, reactive, just flaky, peely, probably not. You probably want to come in, we'll give you a couple facials to get all that moisture into your skin to where you can handle it. So when you're dry and sensitive, usually you react a little bit more, and I just want to get you to that point where you're not going to have any reaction.
Does this help with scarring and deep pores?
Yeah, so it's really good for pores. Although you're born with your pore size, there's not too much we can do with it. When you peel that skin down and you get everything cleaned out, they will get a little bit tighter. So they shrink up a little bit, which gives, you know, the appearance of not as large pores. But yes, very good for scarring. Again, it would be in a session. We'll do maybe upwards of 4 just to get the best result. But yes, very good for scarring too.
Will wearing a mask cause any irritation to your skin while you're peeling?
It could, but the best part of it, as I said, we're going to send you home with that hydrocortisone cream, and that's going to help with any irritation. So what I would have you do is apply a thin layer before you put that mask on, and then even throughout the day. So if you're going to have to wear that mask all day, you'll apply it a couple times just to help with any of that irritation.
Now, immediately after they get this mask, this peel, should they refrain from wearing a mask? How long should they wait?
Yeah.
I mean, I know this is kind of new in this day and age to have to even worry about this.
Right. Whenever I have someone, I've been doing them since COVID. So what I'll have people do is just kind of hold their mask up, go check out. When they get to their car, obviously keep it off. You're not going to touch anything or do anything with this peel for about 4 hours. And in 4 hours, we'll cleanse, you'll put a peel pad on, and then you can go about with your mask.
Everyone's saying, does it get rid of dark spots, pigmentation?
Yes. Great
for this,
yes,
right?
Very, very great. So you have a couple different options. The VI Precision Plus, if you are concerned with pigment, if you're concerned with scarring pigment, dark pigment, red pigment, the VI Precision Plus is going to be your go-to.
Cool. I think a relative of yours, Elizabeth, said happy birthday, Amy. Love you.
Oh, that's my sister.
Aww.
Thank you.
Hi, Amy's sister.
Hi.
Any issues with microblading? That's a good one.
So that's actually a really good question. Prior to the peel, we can place a little bit of Vaseline, and then when you're at home, when you have your peel pads at home, do not go over your eyebrows. I won't go over your eyebrows anyway. So neither should you. So you'll stay outside of that orbital bone, which again, when we're talking about this peel, before I even send you home, I will go over all this with you. You'll just avoid that area. And sometimes around the nose there can get a little sensitive. You can put a little thin layer of Vaseline. But again, we can, talk through all of that when you come in to get your peel.
Sam's mom said happy birthday, Amy.
Thank you.
Let's see. Is there a product you'd recommend to moisturize leading up to the peel in reference to the question about getting a peel with dry skin?
Yeah, so I would probably put you on a hyaluronic acid and then your moisturizer. So your hyaluronic acid is going to be great to hold moisture to your skin. It really pulls that moisture so you don't become dehydrated. And then your regular moisturizer.
Everyone's saying happy birthday.
Oh, oh thanks.
And then let's see. So we are coming to a close. Some of your questions that are just now coming in, I wish we could answer them. We have answered them earlier in this video. So as soon as we're done here, I'll save it and upload it to Facebook or Instagram, wherever you're watching from. And if you watch it back, your questions should be answered. If they're not answered, please text us. We have many people hands-on waiting for your questions by text message. The phone number to text is 314-991-5438, and we would be happy to answer all the questions that you still have. Okay?
Okay.
Alrighty, we're gonna log out now. Thank you so much,
Thank you,
Amy.
everyone.
Bye.
Bye.